Hello, this is Robert Rickover at Body Learning, and today my guest is Becca Ferguson, who's an Alexander Technique teacher in Urbana, Illinois. And Becca has teaches group classes and private lessons. She's also taught in the dance department at the University of Illinois, and she's been a guest lecturer on addiction recovery and relapse prevention at community health classes at the University of Illinois. Becca's specialty is using the Alexander technique as part of her work in recovery and relapse prevention, and for people with post-traumatic stress disease. And she has evolved a program to work with people who have addiction issues, and we're going to talk today about that whole process. Becca, welcome to the show.
Thanks, Robert. It's nice to be here.
Nice to have you on the show, Becca. I wonder, before we begin to talk about your work, could you say a word or two to our listeners about exactly what the Alexander Technique is, or give them some idea of it?
In a nutshell, the Alexander Technique is a unique body-mind practice for improved performance in all of our activities and for comprehensive physical and emotional stress management, calming and balancing of our nervous system, and healing of many issues such as chronic pain, anxiety, and repetitive stress injuries.
Mm-hmm. And I think most people, when they think of the Alexander Technique, most people who have some knowledge of it associate it with performers learning how to do whatever they do better, or people who are in pain of one kind or another, typically back pain, shoulder or neck pain. Those are the kind of areas where the Alexander Technique is sort of best known. But your particular specialty is working with recovery and relapse prevention. And I think the first question our listeners might have is, what does the Alexander Technique have to do with that?
Well, I have to answer that question by talking about my personal journey with recovery and relapse prevention. And I will keep it brief, but many people get into becoming addicts and alcoholics because of chronic pain, typically, or anxiety or other issues that they are self-medicating. In my case, when I was in junior high school, I was in a very severe diving accident in a swimming pool where I almost broke my neck and back. And as the years progressed from that accident at age 13, I developed chronic neck and back pain in certain vertebrae that were affected in discs, and over the years became addicted to pain pills, and also had serious problems with anxiety and became addicted to tranquilizers. You can't take any of this kind of medication for more than about a month without becoming, at the very least, psychologically dependent on it, if not physically as well. And that began to shape my life, dealing with the chronic pain, and then the dealing with needing increasing supplies of these medications took over, which is, again, very, very common.
Mm-hmm.
And so it becomes a double-edged sword that you have to deal with the pain. You can't really stop the pills unless you have stopped the pain. And my life was a round robin of doctors, and I started seeking alternative measures such as acupuncture almost 25 years ago, and sought some relief with those measures. But basically, it was the Alexander Technique that finally enabled me to become free of the pain, to avoid surgery. And this was not a slam dunk, like it just happened in a year of lessons. It was a pretty long process. But because, at a certain point a person becomes, I was going to Alcoholics Anonymous. I also became an alcoholic, which is also very common with people who take prescription drugs. I was going to AA. I was at times able to stop drinking, but because I was always still taking these pills, which work in the brain in many of the same ways, they hit the same receptors in the brain as alcohol, tranquilizers do in particular, you will start drinking again. There's no way you can stay clean and sober. So chronic relapse became my life. And what happens with the Alexander technique is that it improves as we learn to stop our automatic pilot reactions in movements we do in life that are harming us, that as we learn to use our body in a more coordinated ways, as we restore poise to our functioning, which is the word poise actually means balanced equilibrium. Mm-hmm. If we restore that fundamental nervous system and bone and tendon and muscular poise that we had when we were ancient hunter-gatherers, these lean, mean, fighting upright machines that we were millions of years ago, when we restore that kind of coordination, our whole body changes, including our brain and we get more balanced. And what happens is we calm down comprehensively. And so we can handle all kinds of stress better. And stress is the reason people cannot stay clean and sober once they take away their drug of choice. And this sounds like I'm saying the most basic, simple-minded thing in the world, but people who become addicts and alcoholics typically have a chronically engaged level of stress similar to post-traumatic stress disorder. In other words, from a neuroendocrine standpoint, their hormones and their nervous system are staying in basically an exaggerated frozen place of chronic engagement with stress in a way that unless you fundamentally give people the tools to calm themselves down, then they will relapse. Mm-hmm. And my life, go ahead, sorry.
I was just going to jump in here to just because I think it might help to clarify a little bit about how something like the Alexander technique, which is really about learning how to stop doing patterns that are harmful. And that is something that's pretty unique about the Alexander technique. We're not really generally interested in telling you to do different things than you have been doing. We're more concerned about showing you or helping you to notice for yourself what you're doing that is not helpful. And of course, everything is both mental and physical, but it's maybe easier to understand by saying certain things that you're doing physically that you could label stress, but it could also be labeled muscle contraction. That's what you learn how to identify, and then what the Alexander technique teaching process shows you how to do for yourself is how to stop doing those things. Now, as you said, it's not a quick fix because the habits of producing those tensions can be pretty strong. But I would think from what you're saying and how you're describing your own process, your own history, and just in general, that without you being able to prevent that kind of stress from building up on a physical level, it does seem like the underlying issues that would drive someone to alcohol or drugs or whatever aren't going to go away. And so somehow you have to get at the root of the problem, which is all this excess, at least on one level, physical tension that you're creating in yourself.
Well, that's exactly right. And the technique, as you just said, it teaches us, well, first of all, it teaches us to develop awareness of our whole self. Mm-hmm. And then, when we're aware of what we're doing, whether it's putting, lots of G-forces through our legs as we walk, or having a death grip. I call it in lessons the death grip on the Titanic, where mm-hmm. people are holding on for dear life with their feet mm-hmm. to the floor, and you realize, why am I holding onto the floor like this? I don't need this energy to help myself just stand here or sit here, we develop that mindful awareness of our where we're holding tension, as well as doing things like clenching our teeth, clenching our hands, or repetitive patterns. And then we learn, as you just said, how to stop and then change are these automatic habitual reactions and patterns of movement. And that, in terms of an exact corollary for recovery, when you stop engaging, recovery from addiction is to begin to put together one day at a time, 1 minute at a time. You don't pick up, you don't ingest the substance again, but in terms of calming yourself and changing habits, you also stop and become aware of, again, for 1 minute at a time, of what you're about, what you're doing, of whether you're nervous, of whether you want to go call a friend who's not maybe the best friend anymore for you to hang out with. You learn a mindfulness about how you're living, that you stop, and in those intervals. And this is a separate issue, but not really. The physical process of doing that, which is the absolute unique thing about the Alexander technique, the physical process of being mindful and then stopping, in that interval of stopping and pausing, which they call inhibition in the technique, that interval creates enormous choice for us to make different choices and to learn how to redirect our behavior into new, healthier ways of living. And
yes, and can I just interrupt?
You can
with
jump in any time.
All right. You, in the bio information you sent me, you included a quote which I don't remember reading before, but it's perfect for this. You're quoting a man named Dr. Wilfred Barlow, who was a very famous Alexander technique teacher. He's also a physician in London. He died a number of years ago, but in his book he writes, Alexander's work is concerned with the moment-to-moment management of our perceptions of ourselves. And that is exactly what you're talking about, that any change that you make in yourself can only be made in that split second of the change. You can't change tomorrow, you can't change yesterday, you can't even change a second earlier or a second later. It really is just now. And I wonder, I know that phrase you used that I've heard often, 1 day at a time. I wonder if really a more accurate phrase might be 1 millisecond at a time.
Absolutely, Robert. And that's the thing, the reason this is such a message of hopefulness, to have a physically based process for people to get recovery. And I will want to hope that we'll have a minute to talk about what I've observed in some of the classes I teach at treatment programs. But it is stunning that, recovery is built. Recovery is a cognitive and physically based behavioral change process, meaning, again, a person often in the beginning, when you take away someone's way they've self-medicated, whatever it is, whether it's street drugs or prescription drugs or alcohol, there is a time period when people are doing what is called white knuckling it. And they are, the cravings can be horrible and they can be very, very intense. And getting through that period of time to have physical tools that can help someone literally calm themselves. And the technique, again, offers that. And then a mindfulness-based process helping you learn how to be in your own skin, in your own body, and tolerate, literally, as you just said, from one moment to the next, as Dr. Barlow said, moment to moment. That is the key. And you put together enough of those moments and you create a day. And then you create another day. And all of these hackneyed cliches, I've been going to Alcoholics Anonymous on and off for 20 years. And at times they are just the most nauseating cliches that you think, oh gosh, this is just, I can't hear this again. And then one day you turn a corner and you understand that these simple phrases like that are lifesavers and that they are so meaningful. And if you can somehow get through that glass ceiling of somehow your nervous system over time, if you can put together enough of these moment to moment little changes, you then build sobriety and you build clean time. And one day your nervous system really is rewired and you don't have the cravings anymore. And the technique is a powerful, innovative tool for jump starting that and giving people immediate calming, immediate ability to handle cravings better.
And it's immediate calming that you create for yourself once you've learned some of the basic ideas of the technique. And I would think that's an incredibly empowering thing, because it really says, okay, you're actually in charge of yourself now. And that can be demonstrated on a physical level at will. That's a pretty amazing thing about the Alexander technique, I think.
I completely agree.
Yeah. Why don't we conclude by you said you wanted to talk a bit about some experiences that you've observed in classes that you've taught. I think that might be a nice kind of final thing to talk about.
It would. I'd like to add one more thing about post-traumatic stress disorder, because addiction and post-traumatic stress disorder, as we all know, from the media and from these different military people coming back with post-traumatic stress disorder and many ramifications. These are both areas, that is, addiction and post-traumatic stress disorder, that are of epidemic proportions, especially in the U.S. And as a tool to build mindfulness, I have to say this, Robert. In the world addressing addiction and PTSD, one of the newest basis for treatment is a mindfulness-based program. And one of the reasons I'm calling what I'm doing mindfulness-based Alexander technique is to play off these other programs as a complement to what they do, that is more from a mental standpoint only, that gets people somewhat in touch with their body, because that is what mindfulness programs do. However, the technique is a quantum leap that expands upon a practice like that, because it gives people these in the body means to immediately calm themselves. And my journey included not only recovery from addiction to pills and alcohol. I got into those because of the chronic pain and because of the post-traumatic stress disorder that developed in my life from some things that happened to me. And it was almost a surprise, Robert, when I woke up about a year ago and realized, oh my gosh, I'm not jumping at every sound. I'm not jumping at some of the sudden movements, or when I'm around certain kinds of situations with too many people in a room. I almost don't have a startle reflex anymore. And so the implications of this for people with post-traumatic stress disorder and trauma are enormous. And so to be bringing this into other settings, and with integrated medicine and behavioral health settings for comprehensive rehabilitation of people is the direction I hope to see this work go. And now I will get off of that and just say where I'm working, which is a state of Illinois funded, and other, United Way, U.S. Bureau of Prisons funded programs here in the Champaign-Urbana area. And I'm dealing with residential and outpatient clients who are people with very limited resources, who often have nothing left, and they are often in serious legal trouble that has gotten them into these places. So I'm dealing with a population that is pretty worn out and pretty raw. And to see in the space, it is a work in progress. It is so moving and such an honor to do this work. And it's not about me, it's about the technique. But to be able in a 50-minute hour, sometimes that's all I have with what I'm calling a lie down, which is the Alexander Technique constructive rest position. Other people call it that often. To see people getting calming through a simple thing that makes them feel good, lying on the ground with their head up on their back of their skull with a few books, calming as I go around and gently, work getting their neck in the right position with gentle touch, easy verbal directions, because often many of these folks they're so wiped out, they don't think that clearly. They have trauma issues themselves. To see that with those measures, showing them how to sit up and working on getting them finding their own up and giving them verbal ways to locate themselves in a room, to find their own horizon line. I have very unique ways of describing this work that take it out of the Victorian Alexander language, because I've got people who have very short attention spans often and who want to hear a message of hope pretty quickly. And it is the case managers I'm working under and the director they've been just amazed in very short amount of times to see people coming into their bodies, people making eye contact who won't look at you, people who are depressed, people who are, won't smile, won't talk, look at the floor. These are often things that might seem to hear an Alexander Technique teacher say. These are huge victories, though, because in such a small amount of time to be able to make a difference where they're looking forward to this work. I give handouts, these bone dead simple handouts that explain things that they can take themselves through and give them just a few very short measures to take on their own. And it is making a difference it's just so exciting. And I'm really hoping that the Alexander Technique and other will be taken into these become something that changes the paradigm and the protocols at many of these treatment places. And I'm hoping more Alexander Technique teachers will get into this work. There is Dr. Jane Dorlester in Brooklyn specializes in trauma patients. She, however, is a psychotherapist, so it's talk therapy and infusion. The only other person I know doing this work is Laurel Podolsky at the Mayo Clinic.
Yeah.
And I have visited Laurel, and we've talked quite a bit about, what she's doing in what she does in the Mayo Clinic's addiction programs. That is all good news for this and for the future of this work, which is resonating so strongly with the clients I'm working with, and I'm just very, very excited about it.
Well, I think this might be a good place to bring our conversation to a close. If anything that we've been talking about intrigues you, we're certainly going to put a link to Becca's website by the interview. And we'll also put a link to a website where you can learn more about the Alexander Technique and where you can locate a teacher in your area. And I would also say to any Alexander Technique teachers who are listening to this, this definitely just strikes me as a field where our work could be much more used than it is. It would obviously require connecting with whatever agencies in your area work with people in recovery. But it certainly strikes me as just a perfect match for the Alexander Technique teaching skills.
Absolutely.
So, Becca, thank you so much for being on the show today.
Thank you so much, Robert, for the opportunity to talk about this work.